The opinions expressed by the host and guests in this show are not necessarily the views of Children's Health Defense.
Good morning, CHD. Welcome to Pediatric Perspectives, where we are taking a look at children's health challenges from a different perspective, one that's not afraid to give you the honest truth. We're not afraid to ask the tough questions. And we are so blessed today to have a guest, a friend of mine, Dr. Cammy Benton, who we met, oh gosh, I think it's been about a decade ago when we were involved with Physicians for Informed Consent and other events around health freedom. And you are a shining light in the world, honestly. I'm so grateful that you're on the show today.
Thank you, Paul. Well, Dr. Paul, I guess I should say for your audience. Yes, it was 2015, founding board members of Physicians for Informed Consent. I'm very proud.
Yeah, no, that was and is a very important organization. They're doing amazing work. You have a long list of accolades as far as what gets you to be the incredible doctor that you are. You are a functional and integrative medicine physician, a speaker, founder of Benton Integrative Medicine. That's your concierge practice in Huntsville, North Carolina, that you formed in 2016. You're board trained in family medicine. You've spent more than 2 decades pushing past symptom management. And we're going to touch on that real shortly because you really ask that harder question. What does the body need? And that's, for those of you who are listening, we are going to cover PANS and PANDAS. Don't panic. Every time I hear those terms, even as a pediatrician, I am retired now, but man, it seemed complicated. And I love your approach. At this show, CHD TV Pediatric Perspectives, we get a lot of questions from viewers about why their unvaxxed child is struggling with this or that. And so at the onset, we're going to cover some of the symptoms. I love the fact that you don't focus on managing symptoms. You focus on really healing the body from the whole perspective, which you'll get into. But for our viewers, you'll hear some symptoms go, oh, I didn't know that was related to PANS or PANDAS. Oh, wow, I didn't know. Me too. Okay. So, and most doctors out there, the mainstream trained especially, haven't a clue about these things. And anyway, they're just treating labels. So I love the fact that, you treat the body as terrain, not just suppressing symptoms, and you follow rigorous science. You are a founding board member of PIC, Physicians for Informed Consent, as you mentioned already, and you're a founding member of North Carolina Physicians for Freedom. You're also completing a fellowship in longevity medicine. Woohoo! I'm going to have to touch base with you on that one. Anti-aging medicine, and you are listed in the top 100 healthcare heroes in RFK Jr.'s book, The Real Anthony Fauci. And you are indeed one of those heroes. So let's jump into it. Sorry, that was a long-winded intro, but I wanted people who didn't know who you were to get a sense of the incredible individual and physician that you are. Maybe start with just what is PANS and PANDAS? And for viewers, don't get bogged down on that term. What are some of the most frequent symptoms? And then we'll jump into more.
PANS is a pediatric acute onset of neuropsychiatric syndrome. Like, is this the sort of what it's named? And you'll hear PANDAS as well. And that's specifically because the idea started that they thought strep caused it, but then they soon realized that many things can trigger PANS. And so it's just PANS is probably the easier one to go by. And the psychiatry, people understand the field of psychiatry, have anxiety, bipolar, depression, schizophrenia. Those are things that people are used to being used to those names. But it's the rapid onset of these symptoms that kind of differentiates it from everything else. So this could be, it's like Tuesday you had your kid was this way, and Wednesday suddenly they have OCD, obsessive compulsive behaviors, tics, rage, just crying, severe depression, just a big shift in your child out of nowhere. And sometimes it can be even a little bit more subtle, like suddenly they don't want to eat. And it's kind of like they could present like anorexia, but it's sometimes it's not that they don't want to eat, it's that they can't handle the textures or they don't want to swallow the food. So they're hungry, but they can't eat. Like, where did that come from? Right. And so that's where if you're able to like have a timeline of a normal healthy child and then suddenly you don't, that's when I recommend that every parent write down as soon as possible, like recent infections, recent exposures, what were their behaviors like before versus afterwards. Maybe get some video content if it's really severe to take in to see your pediatrician or your family physician.
Sounds to me like 50% of the kids I had in my practice, and I wasn't recognizing it. Although I don't know that they all had the sudden onset piece of this, but wow, talk about the numbers in a typical practice today of anxiety, kids with ADD, ADHD, impulsivity, and then all the neuropsychiatric diagnoses. It's a big chunk of our what we do, right? It's
Yeah.
just incredible. So you had an experience in your practice that really awakened you to whoa about PANS. Can you share that? Because I think that's interesting.
Well, I say kind of going back back in the early, I guess I really started practicing medicine back in 2005. And within a few years, I started seeing some of the unvaccinated families and thinking about how healthy they were. Like they're so healthy and they never needed to be seen. And that was sort of my experience in the unvaccinated population that started waking me up to the idea that there were issues. But really, since COVID, I feel like COVID really, there was a shift in the health of my unvaccinated population
Mm.
more than before. And there was even a study that showed like people that presented during the lockdowns had like a more sudden onset of PANS. So you think that's why this is more than just an infection. Like I would say, PANS in general is a combination of infectious disease, the immune system, psychiatry, environmental health. And so that's what makes it so confusing. And no one is claiming this disease process to be their own in medicine. And in medicine, we're so fragmented. So if it's not like a heart or a lung or a kidney, doctors don't really know what to do with it. And this is one of those really mixes of that. And so I started seeing this in my unvaccinated populations. Now, I have a direct primary care concierge practice as a monthly membership. So I had some of these had been with me for a while. And then of course I'm going to naturally, kind of like you, Dr. Paul, that you get people that maybe have higher risk of these issues anyway, due to sibling pairs or cousins that might have had vaccine reactions. So they came to someone who was open-minded and compassionate for choice. But by virtue, you are going to get maybe a higher risk population because something in that mom's, I believe, trust mom's gut intuition that something is different with their kids, that it's not there yet, but they just happen to be in the right place at the right time when things like start having an issue. So I actually have a couple families, like they're all like unvaccinated, and they started with pan symptoms. Like it was after they were usually in a moldy house, and then they got pneumonia, or they're in a moldy house, and then they got COVID. So it's not just the infection itself, it's the infection on top of an impaired terrain
Mm.
uh, that has set them up for this situation. And so then when you're seeing sibling pairs, that's where I was like, absolutely, this is the environment that we have to be considering because they have similar food, they have similar environments. But I will tell you, these families that I have that have PANS, they were already on top of a healthy diet. They were already on top of trying to have a good, healthy home. It's just maybe mold. Like I would say the most consistent has been mold in their homes prior to discovering this issue. Uh, but that's the concern for me as a sibling pairs.
Yeah, and you have several, I understand.
Hmm.
You also largely, well, you tell us, your practice by virtue of the way you've set it up, you do you have vaccinated patients?
I have some, usually mostly partially vaccinated patients. I would say most direct primary cares don't offer vaccines anyway because it's such a small population. We have like my patient panels are only about 350. So we have very
Okay.
small panels. So it just doesn't justify having vaccines, especially because we see adults in my family, in my practice, it's family medicine. So we see
Right.
adults. And so it just doesn't make sense to carry vaccines.
I can add in that in my practice, I had, oh, I don't know, for many, many years at the height of my practice, 15,000 active patients, and about 1,000 of them were unvaxxed. So I got to see it all, the unvaxxed, partially vaxxed, fully vaxxed, and we were seeing all these symptoms across the board. I think even more so in the highly vaccinated, but well, certainly more so in the highly vaccinated. But this is This is different what you're
Different.
describing.
Even the depression, anxiety, all that stuff is running rampant, but a lot of that's more insidious. It comes on slowly. This kind of brings me back to the whole nature versus nurture and the exposures of electronics, the overexposure to videos and cell phones. And I mean, I see people still at families at tables, and the kids I have iPads and things like that. That's not good for their nervous system. So we have this the again fluorescent lights, like especially more sensitive people, if they're in the school and then they're dealing with the flickering that's not really obvious to us, but that affects the brain function and cortisol levels. You have what's missing too is rites of passages that indigenous cultures have. Like it's very clearly you're a kid, you're pubertal, like you have like ceremonies about these. So you had to go kill a lion. You had to like when you turn like a certain age as a boy in Africa, maybe I don't know, like, but they have rites of passages. But here, like everything is just kind of blended in together. Kids are going to their own bedrooms to watch TV and their video games and not really being with the family at the dinner table. There's all those complicating factors when it comes to mental health in kids. It's just the acute onset is what differentiates the PANS versus that. I mean, we're clearly in an epidemic of mental health issues in this country
Yeah.
across the board. This just brings in a whole different level of the environment. Like what are the environmental what's the environmental terrain like? Or like increased C-section rates. The increased C-section rates affects your gut microbiome. Antibiotics early on affects the gut microbiome. But again, I'm dealing with healthy families already. So that's what concerns me. Like these are people trying everything they can to
Hmm.
prevent this, and yet it's still happening. And I do believe it's gotten worse since, on one hand, I believe it's gotten worse since COVID. So there's definitely more awareness of the diagnosis. But then, but things, I feel like immune systems in general have shifted since COVID. Because I've been in family medicine for 26 years. Before COVID, it was like really my families were healthy. Like they were rarely seen. Like we do, like in our clinic, we have about 1,500 patients, and they were overall healthy. And you saw the occasional strep or this occasional ear infection, but we didn't even use antibiotics in most of those kids because we could use homeopathy, chiropractic care, and then that was fine. I very rarely gave like antibiotics for anything. But since COVID, kids are getting sicker with RSV. They're getting sicker with all the things.
We can kick that around a little bit to speculate on why that is, because I mean, you're talking about in your case, most of these families, I'm sure, did not get the COVID vaccine. So I know friends and relatives who got the COVID vaccine, and many suffered really severe health consequences. But we're seeing it now in unvaccinated, and that SARS-CoV-2 was a nasty creation. And the world got it, right? Whether you got vaccinated or not, you either got exposed through the vaccine or through the vaccine and the illness, typically, or you got the illness.
Mhm.
But before you speculate a little bit on why you think COVID maybe has been so disruptive, when you say rapid onset, I think it's important to know, are we talking minutes, hours, weeks, days, months? What is rapid onset?
It's your kid was normal, then they're not. It could be the next morning when they wake up. It could be in the afternoon when they come home from school. It could be literally from moment to moment. Is shocking.
It's pretty sudden.
It's really sudden. It's
Okay.
very unmistakably like what happened to my kid. My kid is so this is not your typical, again, oh, they're maybe a high-strung kid and then they slowly develop anxiety at puberty kind of thing. That could be something different. I mean, that's still a complicated
Yeah.
situation there too, but that's not your classic PANS or PANDAS patient. It's your kid was regulated before. Now they're like screaming and they are running around the house and like they're in pain, but you didn't see anything happen to them. It could be literally hours or a
So
day.
So a lot of mainstream medicine doesn't really understand it or even probably diagnose it because they don't understand it and they don't know what to do if they do diagnose it. I remember as a pediatrician, before I was a little more enlightened on what was going on, I didn't want to go there because I wouldn't know what to do. And there were very few experts in the mainstream world that I was in at that time. We're talking back 15, 20 years ago, to even know who to send the kid to.
It's still an issue. There's a documentary, My Kid Isn't Crazy. It's on YouTube for free, so people can see. But it does go into even that divide. I feel like in general, anytime there's a new paradigm shift or there is something new that just takes feels like 10 to 20 years for it to become regular practice. Oftentimes when there's a new concept, there's just a battle for doctors just to keep things the same. I think doctors are not very good at change in general.
No.
Now, this happened with SIBO, which is a stomach infection
Mm-hmm.
that a lot of people actually have, but it was considered crazy until the Super Bowl put on a commercial for rifaximin, and suddenly doctors like, oh, I guess this is mainstream enough. I can like assess this now. But before that moment, I think that might have been in 2016 or 17. I remember finally seeing it on the Super Bowl commercial, and I'm like, what?
As soon as there's a pharma product.
As soon as the pharma approves, then they can actually.
We have a real product for you. Now we'll acknowledge this.
This goes back to Galileo. That goes back to Galileo. Scientists throughout history, when they bring something new that changes the paradigm, or how we approach things, people are just reluctant to change. And in this environment with the internet and like cyber, like they can cyber destroy you in a heartbeat if it doesn't meet their needs. So then, but that's where this documentary kind of goes into the struggle that the doctors had early on and just trying to get information out there. And these people had nothing to gain by this by any means. They're just trying to figure out their own patients. And that's usually how it starts. Is like you start seeing things that don't make sense. And you find other like-minded doctors, hey, are you seeing this? And then let's try to come up with a problem. Let's try to figure this out. And then you meet resistance. Until it does. I think the AAP finally approved, I guess, endorsed the idea of PANS about a year ago in 2025.
Yeah. So let's jump to testing. So what would be the first thing you would do? You've got a parent comes to you with their child who has sudden onset of any of those neuropsychiatric symptoms, anxiety, depression, ADHD, OCD, you name it. Where do you start?
Easy things that you can do in the office is a strep culture. I would not just do a rapid strep because that only detects a little bit of strep that's out there. I think I've heard over 80 strains of strep anyway. So strep culture would be safer to be able to detect that. But you do a throat culture. You can actually have anus, like the anus could be infected. The gastrointestinal tract can be a source of strep. So it's some people do stool studies, advanced stool studies, which is not your typical office, but that's the stool studies you can do. But blood testing, you can do an ASO titer or an anti-DNase titer to see if those are significantly elevated to suggest a recent infection. But those are just the strep. Now we're finding that mycoplasma can do this. Two of my patients, they both had mycoplasma pneumonia that triggered theirs. They both lived in a moldy home, and then they both had pneumonia, and then their anxiety and OCD sort of flared at that time, and it turned out to be mycoplasma that we were able to find.
So that really speaks to either an autoimmune or an inflammatory something going on. Would you be ordering tests to look at immunity and inflammation?
Yeah, there's the Cunningham panel is sort of the easiest one to go look for. I think it's about $1,000. And this is where a lot of people, I am so sad for so many people who don't have access to the funding to do really good
because insurance doesn't cover it.
Insurance doesn't cover that because until the AAP approves it, then it's going to be considered experimental. But it does detect brain autoimmunity. There's other like Cyrex Labs has brain autoimmunity panels. Things like that. But Cunningham seems to be more geared towards PANS specifically, and it's super helpful.
Yeah. I did that a couple times in my practice. Probably should have been doing it way more than that, but it was that barrier of the cost and back in the early days, my not understanding the importance and the power of knowing what you need to address.
Right. I do this and it's still overwhelming. Like I literally, even thinking about this podcast, I was like reviewing things because gosh, there's so many, because PANS is not just an infection. Again, it is your immune system. It is your gut. It is the home environment you live in. It is the infectious disease. It's the autoimmune patterns in your body. And it's also the nervous system regulation. And this is why I think also in addition to the two like COVID infection, it's the nervous system that probably set a lot of people up for worsening during the pandemic because of the stress and fear that people were under. And again, they found there was, like I said, there was one about lockdowns. They found worsening symptoms of PANS and how that popped up. Could that have been? We don't know. It's probably impossible to really know, but like we can surmise that the stress of the lockdowns, the lack of connection. I even still wonder because pretty soon after, like within a year after the lockdowns is when I started seeing my kids get sicker from even other things like RSV more frequently. The severity was worse. And we are meant to be in community and we share germs all the time. And when we went into isolation, I still wonder if we're still feeling the reverberation of the isolation and the lack of community. Our germs need to be in community as well. Really, it's
That
not
is
for us to isolate.
that's a really good point. I was thinking it was mostly that the SARS-CoV-2 and the spike protein were so disruptive to the immune system and were triggering autoimmunity all over the place. But you're spot on. I had forgotten to think about that prolonged isolation. I mean, kids not going to school. It just
Right.
sort of disrupted a lot of things. And I've talked to so many doctors and providers out there who are experiencing just what you've said. A lot, kids are just sicker with all sorts of things. It's like, wow, that is
And
fascinating.
right. And a lot of parents don't know this, but 70 to 90% of your serotonin receptors are actually found in your gut. So
Mhm.
serotonin is your sort of happy neurotransmitter. And so if that's the case, and again, you're dealing with kids, higher rates of C-sections, more antibiotics, but then you have all these that opportunity passed in really a critical time of development for children on many for all of us, quite frankly. We're all like I'm still traumatized by the COVID lockdowns and what happened during COVID, so I know that other people are too. And just thinking, about all that stuff has just set our terrain up for it to be weak and setting up problems with the immune system and the disruption of gut flora. Like we know that even schizophrenia, like they found like how much the gut can flora can affect the severity of schizophrenia. So we know psychiatric health can be worsened by your gut flora or by the nutrients that you take in. And so you have all these kids, like it is basically this is the bowl of that plus processed foods and we're just our kids are toxic.
Yeah.
They're just our kids
We've
are
reached a threshold, I think, where most kids can't handle the level of toxicity they're exposed to. So you would test, I think, for mold, probably Lyme, Bartonella, Mycoplasma, EBV. What other things and in what order?
HSV. I would start with just the strep because that's easy. Strep and the mycoplasma, all things you can get those through your regular lab, and it's not like a crazy cost to that. If I'm really concerned, the Cunningham panel for sure. And then if those are not positive, then I would start digging into the Lyme testing. The Lyme testing, the problem is through your regular LabCorp test, there's concerns that it's not as sensitive as like IGeneX or Galaxy Diagnostics. But to do even those tests are really hard to get people to afford. That test can run anywhere from $1,000 to $2,000 easily. And the cheaper you go just means less testing that you're doing. It just is what it is. And so if you can swing it like doing a $2,000 tick test is great. But that's if like and here's the complicating thing there is the fact that you can have co-infections too. So you can actually start with the idea of, well, this is strep or this is mycoplasma, but it doesn't mean you don't have another infection at the same time. Why? Because things like mono can be like an old infection that can reactivate. That's also not commonly accepted in conventional medicine either about the reactivation of mono. But that is a real thing that happens for people is that it's so other infections that were there, they're kind of smoldering in the background. When your immune system takes a hit, then these other things can rise up and cause a problem. So that's where it gets really, it's worth working with someone who does functional medicine because even for them, I can tell you it's overwhelming how much there is to look into it. I will say a really quick and dirty test to do is to give your child ibuprofen like 3 times a day, like the proper dosing depends on their age, obviously, but you want to give a good solid dose of ibuprofen 3 times a day for up to 7 days. If you have improvements, that's like an anti-inflammatory effect on the
Hmm.
brain. And so that's like a quick and dirty test that says, yes, let's test more. Let's spend the money for this because kids with regular OCD, regular depression, anxiety, that's not going to help them at all. And it's not 100%, but if it's positive, if you have definite improvement, that is when you say, yes, we got to go down this
Figure
track.
out that source of inflammation.
Absolutely.
Yeah. So I don't understand. Maybe you do. How does strep cause brain issues? I mean, I know strep throat, I know perianal strep, but how does it affect the brain?
It's molecular mimicry is the word. So apparently the protein on the strep, if you have a leaky gut, so this is where you go back to the gut. If you have a
Hmm.
lot of gut inflammation, and so your gut and your brain are connected, they call the gut the second brain, or in the spiritual community, it's actually really the third brain, the heart, the brain, the heart, and then the gut. They all
Yeah.
actually have neurotransmitters. But if you have a leaky gut, then that means that that strep antigen, the protein, can actually cross over and go to where the basal ganglia is and has similar proteins in the neurons in the basal ganglia. The basal ganglia is where what really is causes all the behavioral issues. And so this is you could really even call this a basal ganglia encephalitis. Really, it's
Wow.
an inflammation of the basal ganglia.
Wow. So how does that help us in maybe we'll pivot because we're running out of time. How does that help us in managing? So we've got a viewer, let's say, whose child has sudden onset of neuropsychiatric or OCD or ADHD or whatever, any of those massive array of symptoms, and they don't have the money to do all the expensive testing. If they wanted to do something to help their child, where would you start?
I would still start with the easy lab testing, the cheap stuff, the ASO titer, the anti-DNA.
Figure out the strep.
Figure out the strep and mycoplasmia. Those are two low-hanging fruits of trying to find something. And then doing a trial of antibiotics for that. Some kids do well with just like a 14-day. Depends. If the earlier you catch this, the better. If you can catch this very early on, your kid will have a better likelihood of really totally recovering. So trying the antibiotics early on is helpful. And working on nervous system regulation, hands down, is like you can't do one without the other. For the parents and the child, like this is not just a child thing. It's like the parents have to work on their own nervous system regulation because they're afraid. The parents are afraid. They're freaking out,
Yeah.
and the child is also going to respond to that nervous system dysregulation of the parent.
Yep. I'm going to bring you back for a session on nervous system regulation because I know you have a lot of expertise or at least some great ideas on how to manage that. Um, but you also have to address the gut, right? If there's an
Yes.
issue at the gut level, parents can start there as well, right?
Probiotics are helpful. Prebiotic, you can actually look at prebiotic foods, prebiotics, inulin, um, eating from the rainbow, Roy G. Biv, like eat something from the rainbow every single day. Try to avoid any processed food, avoid sugars. I tell people if it comes in a plastic bag or a box and God didn't make it, don't eat or drink it. If you can't pluck it
Yay.
out, if you can't pluck it out of the earth off a tree, kill it or milk it, don't eat or drink it. It should
There
be
you go.
simple, like ingredient items that you get from the grocery store. Shop on the outside of the grocery store. That will do your child very good.
Yeah, that is so important. And I overlooked it when I was raising my kids 25, 30, 35 years ago, 40 actually, for a couple of them. Um,
Oh, and being outside. Go for walks with your child outside. That's important. Like that's
yeah.
critical.
So in mainstream medicine, I had a few of these where there was one expert who was, quote, a PANS expert, and these families would travel, hundreds of miles to see this person, and they'd end up on long-term antibiotics. Now, from my background in integrative medicine, I'm thinking this this condition probably has a gut-brain connection, and we're destroying the gut with long-term antibiotics. It seemed counterintuitive,
Mhm.
and I don't know. Do you have thoughts about that?
Yeah, I imagine there's probably maybe those cases that might need that. I don't know. I'm concerned about that as well. Like we often will, I will do some short-term antibiotics, but I typically would try to go to herbals and work on gut restoration and along with the nervous system and all that. But yeah, the long-term antibiotics, I agree. There's also IVIG that some people can use. I've not prescribed that yet. It's meant for severe cases, and it's also really expensive. It could be $10,000 to $20,000 per treatment, which is insanity, and because it's considered experimental, so it's often
Mhm.
not covered by
Not
insurance
covered. Yeah.
companies. So it's really a long shot for that one.
If it's infection triggered, which a lot of times you're saying it is, you really need to know what the infection is so you can treat it, right?
Yeah.
You don't want to just blast away at everything hoping you catch it.
Right,
And
because
then if
that's
it's
what you can check for the Epstein-Barr. You can check for Lyme disease. It just that's when you're
mycoplasma
thinking
and
about
all that, yeah.
mycoplasma and all that. That's the hard part is that some of these require the ability to pay more.
Mhm.
And I'm praying that someday integrative medicine is just medicine. Like right now, it's so everything to be able to get taken care of well, it's hard to do that in the insurance system. It's not that the doctors don't care, they're just not given the time. I think there's a lot of doctors who don't believe in any of it, right? Clearly, there's that. But the doctors who do care, they're very limited. They're having to see patients every 10 to 15 minutes, and
Mhm.
they're really regulated by the insurance companies, by the corporations that own them, and then they really can't help you. And the insurance carriers are considering all this as experimental. So it just takes a lot to get this covered by insurance. And I'm praying someday it'll be covered by insurance. And that'll make a big difference for the people who can't afford this. And my heart breaks for those who can't afford this, really.
Yeah. I think I heard or read, or maybe you told me that in your practice you have HBOT and you have,
Ozone, IV ozone, EBU
are you
therapy.
using those things for this?
We can, yes. The EBU is usually for more teens and up. The IV ozone can work for kids earlier on in this. So we actually are just finally getting this in, partially because I'm seeing this happen in my population. Of like, I don't have any place to send them
Yeah.
either.
Well,
Like
thank you.
even me, I was like primary care, integrated primary care, and I'm like, who do I send these people to?
Right.
Okay, this is going to be me. So we
Yeah.
just got this stuff in, and hyperbaric oxygen is incredible. Every hospital should have hyperbaric oxygen
Yeah.
for so many indications, and because insurance doesn't cover it, they just don't do
Right.
it.
Right. Well, good for you for stepping up on those they're not easy to implement and they're not cheap to implement. So it's a real investment and you may never recoup your
Right.
investment, but you're helping people. So thank you for that. To close out and I'll bring you back for some other things. Do you have any ideas for our listeners on prevention? Because it's so hard to treat once it's happened. Just quickly review for the viewers, what can they do to hopefully not have to even deal with this?
We have to learn how to live in our environment in harmony. Like that means we need to be outside barefoot.
Bring plants inside too.
Bring plants inside. Literally, the tree huggers. If you hug a tree, they've actually found that it has benefits on your immune system for 7 days. So work on your terrain. Go outside. Make it a daily habit. And eating from the rainbow again. Eating fermented foods. Trying to avoid processed foods. Practicing joy. Sleep is incredible for like for your immune system as well. Like make sure you're like going to sleep about 9 to 10 o'clock, around there, no later than 11. Get your proper sleep. If you're not sleeping well, then that puts you at risk for having attacks on your immune system. So if you create a healthy terrain, that makes it less likely you're going to be affected by any disease, really. I mean, you will, like, there's always that risk, but we're making ourselves stronger in this world of this modern world that is actually not here to support health.
Yeah. I would add to that, avoid the major sources of toxins because
Oh, yeah.
there's so many now. So vaccines is right up there. You're injecting the toxins, you're mainlining it, if you will. There are so many other environmental toxins coming in your food, your water, your air that you're breathing. And then a big one that people don't see as a toxin is screen time
Oh,
because we're
yes.
not meant to be, but that's fight or flight, that's stress. Stress is a toxin.
Stress
And
is a
boy, did I
toxin.
experience that when I went through losing my license. All sorts of health issues started cropping up because I was in constant fight or flight. So you got
I
to
feel
do
you
whatever.
there. I feel you there with that medical board stuff. I'm still dealing with the medical board due to ivermectin after 6 years. And I
Wow.
myself, I started getting sick. I got Lyme disease. I got like my autoimmune flared up, and
Yeah, no, it's a real thing.
yeah, it's a real thing.
It's a real thing. And for I remember when I was still in practice, I would ask kids who were struggling with anything neuropsych or chronic, I would say, well, what's your biggest stress? And it was almost always school. Now, enter COVID, and we've got a whole new massive kind of stress, which was isolation, where humans are not supposed to be isolated. We need loving community. Anyway, I
Right.
want to give you the final thoughts for this episode, and then I'll bring you back. What do you want to leave? What's your message of hope that you want to leave with our viewers?
I believe that community can heal, and being a community, being in nature can heal. I do believe that we have hit our wall as a global community with how far we can go into this modern world without kind of reconnecting with each other, with nature, with our roots. And so we're not going to go backwards in everything we're going, but to be able to survive there, we're going to help our resilience if we can focus on what's really truly ancient, intuitive in our bones, really. So just love, y'all. Love, connection, community, food, healthy food.
It is so important. Thank you, Cammy. Dr. Benton, you are a light to this chaos that we're living in. I will definitely have you back. Thank you for being on the show. How can people reach you if they wanted to? Are you doing any online work, or they would need to be living near you?
No, we actually do some online work. We can't prescribe since my medical board stuff and the ivermectin. I'm down to North Carolina, South Carolina for prescribing, but we do functional medicine across the country, across the world. I still do vaccine consults, but we're actually have a lot of new programs on the horizon. So stay tuned for that. BentonIntegrative.com. I can put that there.
BentonIntegrative.com. Wonderful.
Yeah.
Again, thank you, and we will have you back soon.
Thank you for having me.
I appreciate you all for watching. You can find me at kidsfirstforever.com. I look forward to seeing you next week.
This is the story of Gunnar and how vaccines took his life at 2 months old. Disgraceful. Okay, it's beautiful, but beautiful baby. Alright, so guys, do you want to tell everyone your names?
Brandon.
And Leanne.
Vaughn.
Okay, and so how many children have you got?
4, and we lost Gunnar.
Okay, so who is the eldest child? Who is the eldest child?
Charlie, he's in school.
And how old's he?
5. He just turned 5.
He just turned 5. And then was it Gunnar?
Mm-hmm.
Who would have been
3.
3 today. And then we have, who's Missy?
Bramley.
Hi!
Say hi.
She didn't want to. And she's
2.
2. And then you have
Lively.
Lively.
Mhm.
That's a good name. And how old is she?
8 months.
8 months. Okay, so this is very raw. I mean, it's really...
Well, her birthday is 1/17/17, and Gunnar's was 1/14/14. So
Okay.
they're pretty close to birth times.
All right, let's talk about, because you were just telling me you used to be EMT.
Yeah, I'm on the volunteer fire department there in Sterling for about probably close to 10 years. That's what I used to want to be, was a fireman, EMT, you know. After we lost Gunnar, I really don't have any drive to do that anymore. Just at the camp brings back too many memories.
Sure. So you guys were, when you were pregnant with your first child, were you anti-vaccine?
We weren't really anything. We never really questioned it. I mean, we both were vaccinated by our parents when we was kids, and it was just something you were supposed to do.
So you didn't think to question anybody?
Mm-mm.
So when you were pregnant with Gunnar, did you have any vaccines?
Mm-hmm. I had the flu shot, and then I got the flu. And then,
We brought Charlie home. I got the flu shot and got sick.
So you had the flu shot when your firstborn was born, because
After he was born, I went ahead and got the flu shot, so I wouldn't get him sick. And I haven't had the flu shot in a long time. And right after I got it, I felt like I had the flu. I mean, within hours.
Mm-hmm.
So in fact, you took the flu shot and got sick, which is highly not safe for your newborn child.
Mm-hmm.
Right,
And
so
maybe that's what kind of, I don't know, maybe that's what, I don't know. I still didn't question it. I just thought, that's what's supposed to happen. Right.
So when Gunner's born, do you think there's anything wrong with him?
There's nothing wrong with
He
it.
was a C-section baby.
You've got some lovely pictures here. Do you mind if I show them?
He was a C-section baby who came home the very next day after a C-section.
C-section baby came home the next day. Was he vaccinated straight away with the vitamin? Did he have vitamin K and Hep B at birth?
Yes.
He's just adorable baby.
That's 1 week old picture, I guess.
There he is, 1 week old.
His proud brother.
Trying to find some of him. He was bitty baby.
He was never a baby.
Well,
You've got absolutely, these are just adorable pictures. This is, I presume, brother with the baby, yes?
yes. He's well trained.
So, I mean, he had 2 months of life, which is tragic. Describe Gunner. Describe the kind of baby that he was in those 2 months. Are these all pictures of him in that first 2 months, yeah?
Yeah.
He was happy. He was a nursing baby who's constantly eating and growing.
He's real alert. I mean, pretty strong. He's already holding his head up by himself and everything. He's always looking around.
He's very nosy.
Very what?
Nosy.
So he was nosy, he was looking around, alert.
What's the hospital picture? That was the day he was born.
This is the day he's born. Let's have a look at the picture. Yeah, I've already seen this picture. It's very cute. I've shown them this. It's very cute. The day he was born. He looks a strong little baby. So, you have no reason to not take him in for his 2-month checkup? How was he when you took him in?
The morning of that he went, he was happy. He was himself, nursing and everything. Just a normal day till we got there.
You go in for this appointment and Gunner is fine. He's not sick.
We argued with the doctor for about 30 minutes about his our worries and concerns about shots. And for 30 minutes he laughed and told us that he's an actual doctor and we shouldn't believe everything we read on Google.
Do you hear that, Pete? So they were concerned about the vaccines. They questioned the vaccines, and they said you shouldn't believe everything you read on Google. And did they reassure you that he'd be fine?
Yes. I told him what I was worried about is I could not live with myself if SIDS happened.
You actually said that?
Yeah.
Were you both together there?
Yeah.
That was
all-
my biggest concern.
It all really started, at the time I was working on a drilling rig.
On the what?
I was working on a drilling rig.
Drilling rig.
So I was about 200 miles from the house. This is the day before. I got off work on Tuesday. He has his appointment on Wednesday. When I woke up Tuesday morning to head to work, I had a text message on my phone from like 3 o'clock in the morning. She'd been up all night. She just had a gut feeling about vaccines. And I got a text when I woke up that morning that said Gunner's not getting his vaccines.
You wrote that?
And so I thought, yeah, he is. He has to. He has to have them. You know, he can't go to school. He can't do this because I was uneducated at that time.
Of course.
And so I said, look, let me go to work. I'll do my research, what I can today on the internet and this and that, and I'll get back with you. So I did. It was kind of a slow day at work, so all I was doing was researching myself. And by the end of the day, my text to her was, we're damned if we do, and we're damned if we don't. He's going to die if he gets his shot, and he's going to die if he don't get his shot. So I said, I don't know what to do. I said, we'll just go and talk to his pediatrician. I said, that's what we pay him for. He's the one with the education. I said, we'll talk to him, and we'll figure it out. So we went into this to his 2 month appointment with, kind of we had a lot of concerns, and we was hoping to get some reassurance from the pediatrician.
And at least cut the shots up and do one at a time.
His exact words and reactions to us was he laughed in our face and told us that you can't believe everything you read on Google. And he said, yeah, there are risks with shots, but there's also risk with driving your car. That's why we wear seatbelts. You know, and so I'm thinking, well, that don't help any. And so we just decided that it'd be best for him to have his vaccines.
No, I was still against him. He sent his nurse out of the room to get these shots, and I okayed it because he would not do anything to. We have one. He would not do anything to my baby that he hasn't already done to his own and his own grandkids. So I thought,
That's their
okay.
favourite line, by the way.
Yeah.
Well, the one about the seatbelts, that's not the first time I've heard that.
Mm-hmm.
Following the vax community, I've heard many people on forums and stuff say that their exact same doctors said that to them before. It's like they're coached to try to push the vaccines without caring about parents.
And he also said if I split them up, I was going to traumatize them and make him hate coming to the doctor. Because he'd have to come in weekly for a shot.
Right, so do you know what he had that day?
Yes.
So we had HIB, Pediatrics, DTaP, Hep B and IPV, the dreaded deathly Prevnar, and Vertitech 3. Prevnar is from hell. These are all from hell, but Prevnar is especially made from hell. That is a deathly cocktail. Shame on it. I hope this doctor's still not practicing.
Matter of fact, he is. And also, he just got elected to be something. What was it he just got elected to be over the state of Oklahoma?
On our medical committee.
He's got elected to some chair position.
Can I have his name?
Edward Legayco.
Edward Legayco.
Legayco. In Lawton, Oklahoma.
Okay, peeps, do your thing.
We have also went back to his office a day after our son died. Because we just had this conversation with him. Okay, he let us leave the doctor's office with my son passed out cold on the table. There was no waiting 30 minutes. Get him dressed, get him out. That's our
okay,
appointment.
slow down to tell me again. So he has these vaccines.
Mm-hmm.
I know it's hard. So he has these vaccines, and what happens?
He screamed for about a minute.
They're in the doctor's office.
Mm-hmm. And before the nurse even turned around to leave the room, he was passed out. He just went to sleep. Get him dressed and y'all can go.
He didn't even care.
No.
The doctor never even came back in the room.
To check on him. It was
He just chucked the vaccines in and walked out.
He didn't even give them. The nurse did.
Can you spell that last name? What?
Legako.
Okay, Edward.
Mm-hmm.
Peeps, off you go. He must never touch another child again. That is disgusting.
Well, he thinks he's a real doctor.
Okay, so your child is passed out. The Legago guy walks out, and let me see if I can find you something. And well, then what happens? These are soft.
He stayed asleep. We went out to eat afterwards because it was about 4 o'clock when he got his shots. We went out to eat, and he was a nosy baby. He'd wake up getting in and out of a vehicle. He never woke up. We went out to eat. There was a temperature change because it was really cold. No, he didn't wake up. All the way, we stopped at a tire shop on the way home. He didn't wake up there. And
had you given him the Tylenol?
No, not yet.
Oh, yeah.
And went to by the fire station. Didn't wake up there. Then we went to a convenience store in our hometown, and he woke up screaming. From then on, everything was just a spiral. It was nothing but uncontrollable crying. I couldn't soothe him. He refused to nurse. And when he finally did get to sleep, he'd sleep for a long stretch, wake up, not eat. He just screamed some more. And this went on.
Had an exploded diaper.
Yeah, his diaper, he had an explosion of diarrhea that he shouldn't have pooped that much for not nursing that day. And he woke up the last time about 4 or 4:30 in the morning. He tried to get him to nurse then, and he only took like 2 or 3 swallows. But that's the last time I held him alive.
I'm sorry. It is murder. Just remind you guys, this beautiful baby.
We went to talk to that doctor the next day, and I ended up leaving because I was going to end up murdering him.
The Edward Lagago, whatever his name is.
Our other son had a real bad cold. He was real congested, and so we was going to get him in, try to get him taken care of. We didn't. I mean,
I had intentions
still
of
don't even know what
talking
we're
strictly
doing.
about this.
We don't even really know what we're doing. You know, we just lost our son.
So did he pass right there when you were holding him, or?
No, that was the last time he was alive. He was pronounced at 9:30 the next morning. That's less than 18 hours from when he got his shots. And it turned out that all of this was not normal screaming like they tell you, which is normal. It was beyond that. His legs were so sore I couldn't even touch him.
His legs were so sore.
The thing that really pissed me off about them is they never even went through. Look, okay, if this happens, if this happens, if this happens, if this happens, y'all need to come bring him back in. There was nothing. I mean,
no, it was the normal. They're gonna be fussy.
Yeah.
They're gonna have a fever. Give them Tylenol.
yeah, there was no. I mean, you know, watch out for this or watch out for that. There's none of that. It was just
Tenderness on injection site. That's the same thing they've always preached. Tylenol. He didn't even take his Tylenol. He spit it out during the night.
Did you file a VAERS report on this? Good peeps, good guys.
We tried to get the Edward Lagago to, and
he
refused.
said that we're the parents, and and you know, of course they took him to the city and they did an autopsy and all that on him. They've not even released any information to us. We're his parents, and they're saying it's still undergoing an investigation. That they can't find out
It was a coincidence.
Cause of death. The reason, at first, they ruled it plausible asphyxiation, because when she picked him up at 4:30 in the morning, she laid him in bed with us, and when we woke up at 9:30 in the morning, I found him.
Okay, you're just getting in a hurry and you're skipping things. It went from undetermined to SIDS
I did
to that.
But the reason they went from it was a plausible asphyxiation was based on the fact that he was found in bed. But before it got ruled that, before that got printed on his death certificate, it was a SIDS. SIDS. When we went to the doctor's office the next day, we haven't had any information yet. They wouldn't release anything to us. She got up and left because she was getting pissed at Lagago because he kept saying shots didn't do it, shots didn't do it, shots didn't do it.
And you kept saying, I told you this would happen because you
Yeah,
did.
his legs were black, big marks.
Well, once again, he kind of rushed us out of there, and he went back to his office. Well, I went back and found his office. I said, how do you know this? You know, how are you getting information? We're his parents. We haven't heard anything. Because I heard it was I called. He said he called, and they told him it was plausible asphyxiation because he was found in bed co-sleeping. You know, how does he get this? He's not a parent. They shouldn't be releasing information to him when we're his parents. You know, it was like he already was trying to cover his tracks.
Isn't it interesting how unvaccinated babies don't die like your baby? Days after vaccines, weeks after vaccines. This is a massive cover-up. I think he called the mortuary and he did a deal with them. It's so suspicious.
Well-
It's right there. I don't care what this sounds like. I don't care what they do to us. This is the
Well,
truth. We've
his
got to start
autopsy-
telling the truth, people.
When she
Or more
called-
babies die.
When she called,
His autopsy report said that he was a 58-year-old female
Yeah, it was a
with
joke.
male genitalia. They didn't even have his.
What?
Yes. It was all messed up. His brain. If
they didn't even
This-
do a full autopsy because we called it many times and said, you know, what was his levels, you know. If he died co-sleeping, wouldn't he have like a lot of like carbon monoxide or carbon dioxide built up in his blood?
Your boy didn't properly wake up after those vaccines. He was sleepy. Woke up, screamed, back to sleep. It's the same thing we hear with all of these SID stories. It's the same. Like the MMR autism stories, they're all the same.
Well, he's had about 3 different autopsies done on him now, because we've had Oklahoma. We had all of his slides and everything from Oklahoma. Because I'm not dealing with that. You know, I'm not accepting. You know, let's just sweep this under the rug and push it out the door.
No.
You know how many parents have went home and committed suicide or something, thinking that they killed their child? Because believe me, it crossed my mind several times. You know, it has. That's hard to deal with. That's a tough pill to swallow. That you're the reason your child's no longer with you. And so we found this other pathologist, sent all his slides to him. He did a study, and his answer to us, no, it wasn't. His death wasn't due to co-sleeping, but I can't rule it as vaccine because there's no literature out there to base that upon.
to back him up.
We are his literature.
Well, that's why we're here. So we did. We passed this to
Who's
vaccine.
that?
That was his
My OB.
OB.
Oh, why won't you put that person on? Oh, well.
But we took it to Vax Court. It's in Vax Court right now, and we've also had 2 other special pathologists review all his slides. Three of them, and they're all coming up with the same thing. And just one's more detailed than the other. Now, of course, the Vax Court.
Keep talking. Find your card.
The Vax Court people, they're all coming up and they all got 4 different sides of the story of why he died. I mean, they're just pulling stuff out of their rears while he died, but vaccines are not one of them.
This woman, you do not mess with this woman. She's a friend of mine and she will help you out, okay? She's brilliant. She's here. She's in Texas, so should be good, okay? So just tell her I told you to call and she will help you out. It's disgusting. It's murder.
But everybody says it's just a coincidence.
No, these people don't.
Well, that's just it. These people don't. But the people out there that are still just sheep in the herd, you know, the same people we were 4 years ago. 4 years ago, there wasn't a bus driving around with vax on the side of it. We didn't know.
Sorry.
You know what I'm saying? We didn't know this. I mean, we was trying to do what we was supposed to do as proper parents.
We have to stop this what's his name again? Legago. Legaco pitch. We have to stop him. What does he think he's going to do? Be a senator like Pan and do that? Do they think they're going to get in? Not if the people allow it. We have to bring this man down. And I'm not talking about you guys. I'm talking about us. We can do this. Because this guy murdered your baby.
He's
Yes,
the
he
only
did.
one in his whole office who had not signed a sympathy card.
But again, the man's evil.
Yeah. It's more of a slap in the face. Every day that KSWO News, our local station, does anything on shots, we get to see his face.
And he
Telling you
got
to
money
vaccinate
from
your babies.
vaccinating your baby.
And he said our son will not keep him from vaccinating another baby.
Really? Well, we'll see about that, won't we, peeps? I don't really, there's no words that can make this go away or feel better. Just know that these people are sending you much, much love. They're very angry. And, I mean, this is the second SID story of the day. This is not okay. You know, look at our board with the, which picture are we going to put up? Which picture can I have?
Yeah, you can have any of them. We have multiple copies.
This is a sweet one. Oh, this is it. Look, you want our peeps on the bus? Look at his beautiful eyes. I'm so sorry. He's so beautiful. And he would have been 3 today.
Mm-hmm.
Do you have any advice to other parents? What do you want to say to them?
Go with your gut. Do not ever ignore your maternal instinct, because that's what I did. Research before you vaccinate. You can delay your vaccines, but you can never undo them. And you don't want to live our hell.
Okay, I'm going to go and put some. Have you written his name on the bus yet?
Mm-hmm.
You've written? He's on there.
He's out there.
Okay. Is it Gunner?
Yeah.
Okay, I'm going to go and put him up on the front of the bus. Hi guys, well thank you so much for telling your story.
I can't even believe that they're trying to mandate, vaccines. How can you?
Mandate something that kills.
Yeah, I mean, I don't get it. I mean, someone's must be getting a lot of money somewhere, because, I mean, it ain't worth it. I mean, I feel sorry for these parents that have autistic children, but, at least they still get to see their kid and still get to kiss their kid. My son's dead. I mean, I hope people wake up, do their research, quit thinking that the doctor's so much smarter than they are. I understand they went to school for 8 years, but still, you're a parent.
A school to learn how to push pharmaceutical drugs and potions and make them. Now, people want to know, yes, there are 2 other children. This beautiful girl behind, who is feisty. And this little one here are unvaccinated. How is their health?
Perfect.
Nothing. They are never sick.
Never
I've got
sick.
a 2-year-old back there that's 2 pounds heavier than her 5-year-old brother.
She's 40 pounds. That's 2
I mean,
years old.
So they're healthy, on the ball, any autism, head banging. How about that high-pitched scream?
Awesome. Unless they're mad.
Could this be the biggest lie ever told?
Oh, definitely.
We've done our own study.
Definitely.
It's right here.
Yeah.
I got our firstborn son. Yeah, he was born premature, but he was vaccinated every appointment and everything. I mean, he was.
Hand, foot, mouth from chicken
He
pox
was
when we
never-
had Gunner.
Yeah, I mean, he went in and got his, what is that, Cerebella or whatever? The chicken pox shot or whatever. Same pediatrician. He gets this shot. About a week later, he comes down with these bumps and rashes all over him that we can't explain.
104 feet.
Running fevers like crazy. Take him to the pediatrician. I don't know what it is. It ain't chicken pox. It ain't this, it ain't that. Well, he just got his shots, and then a week later, he's coming down with a rash all over his body. Pretty much hand, foot, and mouth disease. Every time he'd go get his shots, he was sick. I mean, just boom, boom, boom. That's the only thing that was making him sick. Then we got these 2 girls here that's never had anything, and they're the healthiest babies. I mean, she's only 2 years old, and you can hold an adult conversation with her. I know other people that's got 2-year-olds that they're still stumbling around, they don't know what's going on. But they're the healthy kids, they're the ones that are vaccinated and, keep our kids away from their kids. That's the biggest crock I don't understand. If your kids are vaccinated, why do you not want my kids in public? If anything, you're going to be endangering our kids because your kids are vaccinated and they're shedding.
The most ridiculous thing about it is this pediatrician will go on doing his daily stuff, vaccinating kids. Nobody's questioning him. None of the other medics really care. The medical council don't care. Yeah, Andy Wakefield has his medical license taken away for him for fundamentally asking the question, are vaccines safe? Maybe we should look into them. Isn't something really messed up in this world?
Very messed
That
up.
the pediatrician that murdered your baby is just walking around still taking money for vaccinating, still continuing to vaccinate, not even saying sorry, showing no remorse for the fact that there was no doubt that he killed your son.
It's amazing to me how he already had a cause of death before we did. We're the parents. That ain't right.
A made up cause of death is his. All right, guys. Well, listen, you're an amazing family, and please stay in touch with us. And yeah, shame on that pediatrician. Shame on him. And I'm so sorry for you guys. We all are. Everyone's sending you lots of love.
Thank you.